Well, I have this one particular doctor that I was assigned to for my son, and he has cerebral palsy, as you know. He has a trach that was put in, and every time it seems like we ask a question, me and his dad ask a question to this particular doctor, he uses like these big words that we don't understand, and we'll try telling him that we don't understand.
I think the way we look at a doctor-patient relationship has evolved from the old school habit of the doctor tells you what to do, you, in theory, do what you're supposed to do. I think it needs to be more of a teamwork approach, and you talk to your doctor, and your doctor gives you suggestions about how to manage your illness, your child's illness. I don't think it should be a dictation of this is what you have to do, you must do this, and you need to be heard as an advocate for yourself or for your child. So making sure that you feel like you're communicating effectively with your doctor. Are they listening? Are they hearing and processing what you're asking, or are they 3 steps down with the next question and not really hearing you and helping you? Do they communicate with you in words you understand? Can you leave the visit with a knowledge of what actually just happened here? Do you feel like you know what you need to do when you went home? Do you know the game plan? Does your doctor know the game plan? I think it's really important to make sure that everybody's aware of what are the next steps. And if you don't feel like you're being heard, you may need to ask more questions. Make sure you leave understanding what the plan is, what the illness is that you've just been diagnosed with or your child's been diagnosed with. What are the steps to follow? How can I get more information? If your doctor can't communicate these effectively with you despite repeated attempts, then maybe you and your doctor aren't on the same page, and maybe talking to other people about the problem you've just experienced, and maybe they can give you other names of people. You're not wedded to a doctor. Trying to find a new physician, whether it's a specialist, a therapist, a psychiatrist, a primary care doctor, you need to feel comfortable and trust that person. This is your life or your child's life. You wouldn't date somebody repeatedly that you dislike or really don't like the way they do something or don't feel like you're communicating effectively with. So there's no reason to stay with a doctor that you dislike, don't trust, don't feel like you're being heard. I think it's the same relationship. Try it a few times and move on if it's not working. I think it's challenging to move on, but I don't think you're forced to stay. You should not have to stay and be dissatisfied with your health care. I love seeing people get better, coming back and telling me what I did made them better. I definitely love watching kids grow or patients evolve in their ability to care for themselves. So I think that's really fun.